What are the different types of dental implant solutions and how do they benefit patients?
Well, implants can be used in a variety of ways. Implants can be used as individual, to support individual teeth, a single tooth that is. They can be used to bridge a gap, or they can be used to support a denture, or they can be used to support an entire arch, meaning a fixed arch. So a person can go from having no teeth, if they were previously wearing a denture, for example, to where we can place 5 or 6 implants and give them a fully fixed solution. So as far as anyone else is concerned, it would be like getting your own teeth back. It's the closest thing we have to actually getting your own teeth back and being able to, chew corn on the cob or eat steak or whatever it is they could do with their own teeth that they couldn't do with a denture.
Dr. Singh, why do you exclusively use Nobel Biocare solutions?
I used Nobel Biocare originally because they were the company that were originally involved in the research of osseointegration. Osseointegration is the process of which placing a foreign object, in this case titanium, into the bone and the science of developing that so that it would be acceptable to the human body. Otherwise, it would normally be rejected as a foreign object. So essentially, osseointegration was developed in Sweden about 50 years ago or so, and they've refined that process. The Nobel Biocare is the company that did the original research, and I still think they do most of the research to this day. And they developed the science, and so they had the best long-term studies showing how it responded and knowing how various dental implant designs, coatings or surface treatments would respond to the human body, or how the human body would respond to it, I should say, and therefore developing something that would be successful long term. Of course, they have continued to advance the designs. Most of the designs from the earlier ones have come in the development above the gum line. So the implant really hasn't changed that much from the original design, because once you found something that worked with the human body, we stuck with it. And most of the changes or innovations have come from that level up. So allowed us to build different crowns, make attachments for dentures, do full arch reconstructions, attached to different designs of dentistry, compensate for angulations. For example, if it wasn't an ideal placement, you could re-angulate the crown so it would be ideal. So most of the advancements in development have come in that realm. But I think the implant development was once they had invented something that actually worked with the human body, it didn't mess with it too much.
So, the long-term studies are very important to you from a patient's perspective. Is that correct?
Absolutely. These days, there are a lot of companies that are coming out, like everything else in society these days. Somebody figures they can build something cheaper and easier, but the original design, the purity of the product had to be 99.99% commercially pure titanium. And you would want very strict quality control standards to assure that that's what you're getting. So that was important. The way the implants and stuff were machined, right down to the molecular levels as to how it affected the titanium molecules, were all thought to be important into why the body actually accepted it, and why various other trials or designs were not accepted or failed. And so we've kind of stuck with them, with Nobel, that is, because they did the original research, and from that point on, they've continued to refine the process. And we feel that, when I'm placing something into my patients, I don't want to say, well, this company did it cheaper, and that's why I'm using them. I want to say, this is the company that invented this, and they know more about this technology than anyone else, and they have the quality control that goes along with this. and therefore you're getting the best product.
What are the success rates for Nobel Biocare dental implants?
I can't give you that. I could probably get that from Nobel, but we know that implants worldwide, of which Nobel is by far the largest supplier, implants worldwide still have a failure rate. About 5% of implants worldwide will not be accepted by the human body for whatever reason, because it is a foreign object, and in some people the body realizes that that is a foreign object, and we're not going to tolerate that, and we can get it out of here. And those implants that are rejected actually come out amazingly clean. Patient brings it in and says, "Here's this thing fell out today," and it's a true example of how the body can reject something. When you look into the implant site, there's actually nothing there to see practically. Gums have closed over and your body just got rid of it. It's quite amazing to see. Now, having said that, in our experience, our failure rate is a lot less than 5%, but we still let patients know that in worldwide studies, we have to assume that 5% of people their bodies do not integrate and will reject an implant potentially.